When I think of SYNaPsE from my former clinical and academic life as well as at Pfizer, I think about the nervous system. And I think about, if you look at this, you can imagine nerve cells with the gaps between them and the communications between them to affect a change. And then working together, you can also imagine that the result would be far greater and synergistic than if you just added up the individual communications between some of these cells. If you then say, let's replace cells, and have this as a metaphor for what we're talking about here. Let's replace the circles with people and initiatives and organizations and concepts and the communications between those, then you can see how a platform like SYNaPsE as a part of this could really move us forward and accelerate the change. There's a growing repository not only of patient engagement practices, but also to connect again, the people, the organizations, the initiatives in a way that moves the entire ecosystem forward. So that one of the questions that's asked of me as Global Patient Affairs Lead at Pfizer is, aside from what are you talking about, well, do you have some examples? And examples, since we're talking about advancing patient centricity and patient involvement across the life cycle of development and across the life course of people, which are not necessarily the same, what are we talking about at specific areas that might be of interest to a particular group that's working on a particular area? So if you have a system like this that is searchable, where there's an invitation to provide examples from across the ecosystem, you can point people to practical examples that are not only from your own organization, but that allow us to see the perspectives of the various stakeholders across the ecosystem, and so that we can continuously learn from each other as well as from ourselves, and then apply what we are seeing as these examples. Some may be best practices, some may be just practices just to know what's going on, and then we can figure out later on using the quality evaluation and guidance whether or not these are truly best practices. But at least having them there to share is one way to move us forward. And again, the way it's organized is it's not only the practices and the initiatives, but the people, the organizations, so you can say who is doing what, and there's often the pushback that, well, that's specific to that area, so they can do that, but can I really do it here? So having this diverse collection actually helps with that kind of conversation as well. And there are resources in addition to the practices that are also part of this platform, and the number of resources are growing really each day. It's also about the people, as I mentioned. So we each have an opportunity when we are uploading projects and information to also write about ourselves and what we do in this, what our roles are in this space. Because again, this is something that can be confusing across the spectrum with titles that we all have that may not necessarily tell you what we do, but it can actually connect us so that we can reach out to each other in this pre-competitive space across the different stakeholder groups.